Hello everyone, my name is Salomon Manier. I'm a physician scientist from Lille University in France. And I'm pleased to tell you about the poster presentation that we did at ASCO about the neurotoxicity in the KarMMa trial. So as you know, the KarMMa trial is this phase 2 trial included patients with more than 3 prior lines of treatments and treating them with the BB2121 ide-cel CAR T cells. So it's a BCMA targeting CAR T cells. It recently got an approval from the FDA and the EMA, so it's now in practice. 128 patients were included in this phase 2 trial, and among them 23, meaning 18 persons, developed a neurotoxicity. So we looked at the characteristic of those patients developing this neurotoxicity. So what we observe is it's mainly a grade 1 and grade 2 events. There is no grade 4 or grade 5 neurotoxicity in this trial, a few grade 3 for some of the patients. The median onset is early, so it's 2 days. And the median duration of this neurotoxicity is 2.5 to 8.5 days. So it's important to note that there is no late onset of neurotoxicity with ide-cel in the KarMMa trial. What we observe also when we look at the CRS, the cytokine release syndrome, we observe that the start of the neurotoxicity is generally overlapping or occurring within 1 week of this CRS. So it's often associated with a CRS that precedes the neurotoxicity. So it's important to note that, and patients developing CRS can be at risk of developing this neurotoxicity. The important information as well is that when we look at the efficacy data in terms of overall response, PFS, overall survival of patients developing a neurotoxicity or not, we don't see any differences. So even patients with neurotoxicity have a similar outcome of patients that don't develop these side effects. So that's a good news. And then we have also observed that the peak of cytokines in those patients is higher when they develop neurotoxicity than those not developing neurotoxicity. So potentially we can identify here some biomarkers that can allow to treat them early on and try to prevent the development of a neurotoxicity. So I think it's an important set of data we are learning on the road with these new immunotherapies, but we can see from this KarMMa trial that it's quite manageable. Patients who are treated with tocilizumab, corticosteroids, anakinra in some cases, and in all of the cases, it was reversible and well manageable. So this is a good information, and it doesn't affect the efficacy of the CAR T cell.